All right, so generally I walk into a patient's room. The first thing I do is tell them that my name's Charles. Let them know what I'm doing, let them know that I'm going to be their nurse. I generally check their general appearance first off, make sure, look at things like, are they dressed appropriately for the weather? Um, do they look like they have good nutrition? Are they eating well? Are they malnourished? Obesity. Another thing I look for is just general overall skin appearance. They have any tattoos? They have any piercings? Um, do they have any sores anywhere? Any open lesions or anything? Then I generally start my assessment with the head to toe assessment. Starts with the head. I usually look at their scalp, check their head to make sure there's not any type of like hair loss. Check their hair, make sure that it's healthy. Then I move down to the eyes. I look at their pupils, make sure they're both equal and reactive. Do my assessment on their ears. Look inside their ears. Another thing I generally do is check their neck. I usually look for cervical lymph node swelling. Usually check both sides, make sure they don't have any swelling there. After doing that, I usually check their mucous membranes, have them open their mouth, stick their tongue out, generally look in, make sure there's not any malocclusions, any teeth missing. If there is, document it. Also, after doing that, the next thing I generally do is check the back of their neck, see if they have any pain or anything. I usually palpate, see if they have full range of motion. The next thing I'll do is move down to their peripheral pulses. I generally check radial pulses on both sides, usually at the same time after checking one to make sure they're both there. Ask if they have any pain in their hands. The next thing I generally do is move down to pedal pulses, check their pedal pulses, make sure they're both there. Pay attention to if they have any like peripheral vascular disease, if they have diabetes, if there's any numbness or tingling in their feet or in their legs. The next thing I generally do is move to my more focused assessment as far as organs. So I usually listen to their lung sounds first. If you lean forward for me. So I start on the right side here, have them take a big deep breath. Start at the top. Good, blow it out. Move over to the left. Good, blow it out. Stay on the left side. Good, blow it out. Go ahead one more time. All right. One more. Good. All right, thank you. Sit back. Generally start on the right side, then move to the left. Check the left times 2, right side times 3, knowing that there's 3 lobes on the right side. After checking their lungs, then I just look at their chest and inspect it to make sure that they have equal rise and fall of their chest. There's no any type of weird movements when they breathe in or they breathe out. Make sure that its chest is rising and falling normally. Then I generally have them raise each arm up. I will feel their axilla for any type of lymph node swelling, any type of masses or anything. Raise your arm up for me. Generally, I have them raise their arm all the way up over the top of their head, this way right here, so that way it'll stretch their axilla out fully. After checking that, generally I go down to the abdomen next. First, you look at their abdomen, then you palpate. I listen to it first. After listening to their abdomen, making sure that they have bowel sounds in all 4 quadrants, the next thing I do is generally palpate. When I palpate, the biggest thing I do is look for any type of grimacing on their face to see if there's any type of pain whenever I touch. You can push down fairly hard in some areas of the abdomen and feel the bigger organs inside. I always auscultate before I palpate, and then another big thing I do is while I'm palpating their abdomen is afterwards I have them lay flat and then I check it again. After that, next thing, moving down to their pelvis, moving down to their groin area, feel for any type of swelling in the lymph node area. Also check and make sure to see if there's any types of sores, any lesions. Ask them things like, do you have any pain when you urinate, any type of urinary changes, see if there's any type of discharge. After that, focus on their big, like their complaint. Are they here for chest pain? Are they here for trouble breathing? Are they having abdominal pain? And check and see any type of medical history that could be pertinent to their chief complaint today. Another big thing that I usually ask is, their family history. Is there a family history of heart disease, diabetes, stroke, coronary artery disease, anything that could be pertinent to their complaint today? Another thing I do is usually, after I assess them, see if they can get up and walk. See what their daily activities are like. Are they able to take care of themselves at home? Are they able to feed themselves? Are they able to, if they live in a 3-story house or the second story of an apartment complex, are they able to walk up the steps without trouble or pain? Are they able to do the things that they need without the help of someone else? Lastly, I generally ask them, is there any questions that they have for me? Anything besides like why they're here. Then I usually ask them, wrapping up everything, their immunization status. Have they had their pneumonia? Do they take a flu shot? Is their tetanus up to date?